Welcome to lesson 14, understanding our vital signs. This can be found in pages 40 and 41 of your Nurse Workbook 2.0, or you can print the pages below this video, fill it out with me, or come back and print it and fill it out at your own time to test your knowledge, whatever you may like. This video is provided to give you additional education beyond the Nurse Workbook to help you not just pass a test, but provide you with real nursing world education as well. So let's get into our vital signs. I've said it before and I'll say it again. Vital signs do not lie. If there's ever a quick way to see our patient's health in that very snapshot of a moment, this is it, our vital signs. They're the determining factor for so many things. If our patient's sleeping and their heart rate is up a little bit, it could be an indication that maybe they're a little dehydrated and they just need some fluids. If our patient has a high temperature, that could be an indication maybe there's a potential infection. So our vital signs are always going to steer us in the direction of what we think. One thing to remember though is although vital signs don't lie, vital signs can change quickly and our bodies can be really good at compensating. So not only do our vital signs show us at the present moment, but it gives us historical data as we've been watching our patient. We see what they're like when they come in, we see what they're like after an intervention, and we see what they're like as time is passing on. However, our babies are not as good as compensating. We could have one vital sign that gives us a clue, or we could have multiple vital signs that show us our patients are in distress and we need to act quickly. So let's learn the basics of our vital signs. Our heart rate is known for how fast or how slow the heart is beating, and that is counted by beats per minute. This is affected by volume changes such as our hydration or any arrhythmias, our activity level, medications, and more. And so we call a high heart rate tachycardia. Since tachy is the root word for fast and cardia means something related to the heart, we consider a person to be tachycardic or have a high heart rate when their beats per minute are over 100. And in the opposite case, we consider a low heart rate to be bradycardic, and that's when it's lower than 60 beats per minute. Do we see marathon runners and athletes with heart rates of 40 and 50? Yes. And do we see sometimes when people are sleeping, they might drop below 60? Absolutely. It's very dependent upon the person. This goes back to that original concept that we even talked about in Meet Your Organs, because the lower the heart rate, that means the less work that the heart is doing. Except for when we get too low, of course, that's never good. But if we have a heart rate that we see in an athlete or someone that's sitting at that 60 range, that is a good sign. It means the heart's not working very fast. We love it. And what is blood pressure? So blood pressure is considered the force and rate of circulating blood volume among the arterial walls. Since the heart is sending blood away out through the arteries, we can think of our arteries as pipes. And if there's any kind of debris or any kind of clogging going on inside of our pipes, then that's where we're going to have the heart squeeze harder to get through all that crud inside our pipes. And something that can affect our blood pressure is this little formula, cardiac output, that's stroke volume times heart rate, but we'll go over a lot of that much more in our cardiac module, especially in our advanced hemodynamics lessons. So what does a blood pressure reading consist of, and how do we figure this out? Most people know this as a blood pressure number that has a reading from the top number on top and the bottom. Well, this top number is known as our systolic blood pressure. And a systolic blood pressure is when the ventricles are contracting and they forcefully push the blood into circulation. So if we look at our cardiac anatomy, we have a ventricle right here and we have a ventricle right here. And so when these ventricles are squeezing, they're going to eject blood out the aorta. So our systolic blood pressure is during this squeeze and the force of that blood going out. And since this contraction is pretty quick, this is going to be 1/3 of our cardiac cycle. Our diastolic blood pressure is going to be that number that you're going to see below the systolic, and that is when our ventricles are resting and they're filling with blood from the atria. So again, if these are ventricles this is going to be our ventricles relaxing, so that way our blood that's coming from the atrias will come down here and fill these ventricles up. And since filling up is going to take a little longer than the squeeze, then this is going to be 2/3 of our cardiac cycle. And a good way to think about this and remember systolic over diastolic is that our systolic surfs while diastolic digs down under the surfing. So how do we get an actual reading? And a normal reading, or a reading we hope to see, is typically that 120/70. So a blood pressure is measured in millimeters of mercury. So MM standing for millimeters and Hg standing for the chemical symbol mercury. So when we put our blood pressure cuff around a patient's arm and we inflate it, it's going to sense the pulsations of the arm from the squeeze. In old school blood pressure cuffs, because the real word is sphygmomanometer, oh my gosh, that's hard. Sphygmomanometer. It actually used to have a little column of mercury inside of it that would move, and it would be able to determine where the pressure is on the high number, that systolic, and then when it ends to that lower number, that diastolic. So for our medical terminology, whenever we see hypotension, well, hypo is low. So this is going to be a blood pressure below normal. And if we hear normotensive, we know that's pretty much that their blood pressure is fine, and this is, quote, normal. And hypertension is going to be a blood pressure above normal. Now, why do we not have numbers listed? So what really is below and what really is high? That all can be super variable for your patient. Now, anything below 90/60, we pretty much consider hypotensive. But again, in certain athletes, or maybe even Nana that's 99 years old and weighs 80 pounds, some blood pressure readings in this area is going to be totally fine. But this is not always the same rule for hypertensive. We consider stage 1 hypertension anywhere from 130 to 139 systolic and up, and stage 2 whenever you're 140 or higher of hypertension then. And so typically there's something going on that you're having an increase of blood pressure. So we don't ever want to ignore that, and we don't want to treat it as if, well, they maybe just weigh a little more or they weigh a little light, and so it might be normal for them. Moving into our respiratory vital signs, what is our respiratory rate and what is it affected by? Well, this is going to be how fast or slow those lungs are breathing, and that's affected by our airway or lung disease, any fluid backup, acid-base imbalances, activity level, and everything we're going to get into in our respiratory section. Tachypnea, or we also call it tachypnic, is a respiratory rate that's typically above 22. And of course, this is not the same for our pediatric patients. And dyspnea is going to mean that shortness of breath term we always hear, or dyspneic. So dyspnea and dyspneic, same thing. And our bradypnea or bradypneic is going to be the respirations below 12. When we're sleeping, we might hit that 12-14 area. If we're healthy, it pretty much is okay, but anything below 12, we should really get to worrying about, because this could be something like narcotics on board. And again, having historical data is going to teach us what is normal for that patient. What is oxygen saturation and what is it affected by? So this is going to be a measurement of oxygen levels in the body via pulse oximetry. And what this is telling us is this is oxygenation in the red blood cells at the capillary level. So a pulse oximetry or monitor is usually going to go on a fingertip, or maybe even in the earlobe if we're having a hard time with the fingers, maybe even on toes on our pediatric kiddos. This is reading those red blood cells all the way down here. So if we see that we're perfusing all the way to the tip of this finger, that is great. However, if we start getting a low pulse ox reading or an SpO2 reading, we abbreviate for SpO2, then that's actually a late sign, because that means that we're not getting enough oxygen to make it all the way down here. So we do want to be concerned if we start seeing our SpO2 reading below 90. And typically, we really like to see their SpO2 above 94. If they're sitting at 90, 91, we could throw some oxygen on them, but really, what is the full situation? I live at high altitude, so a lot of people that come see me are going to be sitting around that 91 to 94 area anyways. Our bodies can definitely adapt to it over time, but I wouldn't be as concerned about seeing that as I would if I was down on the beach, maybe in San Diego, taking care of patients. And hypoxia is going to be a term for low or lack of oxygen. So pop quiz, what is a respiratory condition that you might see where we would be accepting of 88 to about 92%? If you answered COPD, that is absolutely correct. Chronic obstructive pulmonary disorder or disease makes a restriction in our airway and our breathing. And so because of this restriction, we have a really poor exchange of oxygen and carbon dioxide going on as well in the alveoli and capillary exchange. So we're gonna see lower oxygen levels inside the body, and we will get into much more of this later in our respiratory assessment. And for temperature, what is temperature? What is it affected by? This is kind of a no-brainer. It is how hot or how cold a person is. It can be affected by infections or hormones, age, medications, activity level, or any other health conditions. We indicate somebody is hypothermic or hypothermia if they are below 95.9, and then Celsius, that'd be 35. And we consider them hyperthermic or hyperthermia if their temperature is above 104, and that would be 40 in Celsius. We do consider anyone to have a fever above 100.4. So that would be 100.4 and up. Yes, that is a fever, but hyperthermia is going to be over that 104 range. That's all for understanding our vital signs. Thank you so much for watching. I'll see you in our next lesson.